Hello and welcome to our video on chickenpox and going back to school. Before we begin, we want to emphasize that this video is for informational purposes only and should not be taken as medical advice. If you have any concerns, please speak to a doctor or healthcare professional. Chickenpox is a viral infection that is highly contagious and commonly affects children. While the early stages of the virus are often mild, in some cases, symptoms can be more severe. The classic symptom of chickenpox is a rash of fluid-filled blisters that itch and can appear anywhere on the body. If your child has been diagnosed with chickenpox, it can be difficult to know when it's safe for them to return to school. The answer depends on a few factors, such as the severity of the rash and how long ago chickenpox was contracted. If your child has a mild case of chickenpox, they may be able to return to school after 5 to 7 days. However, if their rash is more severe, they may need to stay home for longer. It's important to make sure that all of the spots have crusted over before your child returns to school. This is because chickenpox is still contagious until all of the spots have crusted over. It's also important to check with your child's school about their policy on returning children who have had chickenpox. In the UK, most schools have a policy that children cannot return until all spots have crusted over. This is usually after around 5 to 7 days. If your child is taking ibuprofen to help with itching, they should stop taking it 24 hours before returning to school. This is because ibuprofen can sometimes prolong the virus and increase the risk of developing shingles later in life. While chickenpox parties were once popular, they are no longer recommended due to the risk of complications. It's also possible for a parent to pass on the virus, so taking precautions is important. If you or your child has chickenpox, it's best to avoid going to work or school until fully recovered. It's also important to keep an eye on your child for any further symptoms, and they should avoid contact with anyone who is pregnant, has a weakened immune system, or has never had chickenpox before. Most people will recover from chickenpox within 2 weeks, but it's important to seek medical help if you're an adult and have never had chickenpox before. This is because the virus can be more severe in adults and can sometimes lead to complications such as pneumonia or meningitis. If your child has had chickenpox, it's important to wait until they're fully recovered before sending them back to school. Check with your child's school about their policy on returning children who have had chickenpox, and make sure all of the spots have crusted over before they return to school. And if you or your child has chickenpox, take precautions and avoid going to work or school until fully recovered. We hope you found this information helpful. Remember, if you have any concerns, speak to a healthcare professional. Thank you for watching.